Hi, welcome back to UWorld's question of the day. My name is Samantha, and we are continuing on with our OB or our obstetrics week. Let's dive right in. A reminder to drop those answers in our comments below. So the question today is that the nurse is assessing a client with suspected placental abruption. Which of the following findings would support a diagnosis of placental abruption? So let's dive right in. Our first option is that painless, bright red vaginal bleeding. This is more in line with a placenta previa, or when that placenta is partially or fully covering the cervix. So when they dilate, they start to bleed. So this again would be more congruent with placenta previa, not with a placental abruption. Option 1 would be incorrect. Option 2, a rigid board-like abdomen. This is indeed in line with placental abruption. Placental abruption occurs when that placenta partially and prematurely separates from the uterine wall. And what can happen here is that we can have maternal hemorrhage, and that fetus is cut off from its blood and oxygen supply. This is by all means a medical emergency, and manifestations of placental abruption will include that increase in intrauterine pressure. We can have an increase in those contractions, that irritability. There's really high frequency and painful contractions. It'll result in a tender and a firm uterus and that board-like, rigid, severe abdominal pain. So again, option number 2 would be correct. Options 3 is referred shoulder pain. This is a sign more of like a ruptured ectopic pregnancy. It could even be referred gas pain, so would not be congruent with an abruption. And lastly, option 4, uterine atony. Atony is the absence of tone, so we have a really boggy uterus. This is the cause of most postpartum hemorrhages, but in abruption we have a really firm uterus, not an atonic uterus. So again, our correct option is going to be option number 2. Way to go, guys. Check out that link in our bio for more resources on all things UWorld.